Dear participants, dear friends, welcome to the current global digital encounter dedicated to the race for the vaccine from invention to effective vaccinations, IP as a tool or as a tool. 1 year ago, the Transatlantic Intellectual Property Academy and the FIDE Foundation decided in the midst of COVID starting to pool their resources in order to organize a series of global digital encounters aiming at better understanding the resilience of the IP system, the evolution of the IP system, the major changes needed for the IP system in a profoundly transformed world. We understood that the world would be profoundly transformed by the experience we are still in. Today is the 12th encounter. It marks the anniversary, the 1 year anniversary of our global digital encounters. So this is something that for us as organizers, Professor DeSantis, co-director with me of the Global Digital Encounters, and Professor Javier Lasqueti Fernandez, coordinator of the activity, jointly with our technical director, Alvaro Arribas Jimenez. We have a lot of emotion in meeting all of you for actually a very emotional topic for all of us, the issue of vaccines. Vaccines is IP supporting all of us for getting quickly vaccines or more quickly vaccines, for inventing them, for producing them, for getting access to vaccines and medicines. This is the topic that we shall review together on this very occasion. But before moving to really our event, I would wish to thank for the splendid support we have received all over the year from our audience. Hundreds of people, up to 1,000 people meet at each and every encounter to listen, participate, actively post comments in the chat. So we are super happy of your presence. And again, today, we really welcome your comments and questions to which we shall respond to each of them. We also want to thank our 1-year-old faculty, composed from extremely glorious professors from all over the world, and also the support entities that have permitted us to develop this activity. This is a pro bono activity. The support entities just joined now by one addition, France Brevet, that is now also since today a support entity of our group. We also have a group of young academics, young scholars, who actually support our activity. And we are thankful to this support group as well. So we are a family for exchanging together ideas on how the IP system exists and could be reshaped, improved, streamlined, or simply completely changed. For discussing today of the IP and vaccine issue, a very sensitive issue, we have exceptional speakers and moderators. We have with us David in alphabetical order, David Mirchin, who is a professor of IP licensing at Tel Aviv University, and also academic fellow on AI, on artificial intelligence and robot law at Bocconi University. David has a long experience in also working as lawyer connected to the health sector, and of course we are all much interested by the Israeli example in the current crisis and in the access to vaccines. Our other panelist is Professor Didier Patry, who is the CEO of France Brevet, who is academic fellow at ESCP, at the London School of Economics, at Sciences Po Paris, and also at Bocconi University, teaching on intellectual property matter, and with an immense experience of how IP rights are created and circulate in society. So having two absolutely exceptional panelists, we have also to guide them an absolutely exceptional moderator, Professor Michael Geist, who teaches technology law and intellectual property law at Ottawa University. His wealth of experience, his depth of experience in this very field will make him the ideal moderator for this anniversary event. There is also a very special event. In the event, we have with us, present today, among the academics, professors, professionals, and also students who follow our activity, the class created by Professor Michael Geist from the University of Ottawa and Professor Zarsky from the University of Haifa, the Global Law and Technology class of the universities of Ottawa, Haifa, jointly with Bocconi. They will also follow this encounter and further discuss and elaborate on it. So welcome to all of you to this exceptional event. I leave the floor right away to our moderator, to our coordinator, Professor Fernandez Laschetti. And I hope that from this activity today, there will be more enlightenment for supporting the entire planet for a better well-doing thanks to IP or thanks to limits to IP. Javier, the floor is yours.
Thank you, Laurent, and welcome you once again to this 12th encounter. I would like to spend so much time as usual just to say a few words. Well, I think that some of the concepts we had in patent law, in the books, etc., have become a reality. I mean, the terms such as expropriation, compulsory licenses, and means and measures that the governments would have to ban the use of patents, etc., have become a reality because of the pandemic. And patents have become an issue for the media, and some of us were interviewed by papers, radio, television, in an enthusiasm about patents that were unknown up to now. I think it's justified because of the situation we are facing with the pandemic and the role of vaccines and the need of vaccination of all the world. But I think that apart from all that noise and even political debate about this, we should consider this issue very seriously and try to find out solutions that will balance the needs of the humans and the respect to IP. So I'm very happy to have here that panelists and moderator that will drive us on the right way in order to understand and to discuss about these important issues. Just to remind you that this is not a webinar, this is an encounter. We are part of the community, and please raise your questions. Please share with us knowledge, papers, etc. As the moderator and the speakers have been so happy to do, and we will increase this community of IP crazy people. Thank you very much, and David, Michael, sorry, the floor is yours. Thank you.
Well, thank you so much, Javier, and thank you, Laurent, for that introduction. It's a real pleasure and an honor to have the opportunity to participate in this. This is a really phenomenal initiative that you've been actively involved with, having not just generated knowledge and spread that knowledge worldwide, but have succeeded in creating a true community around some of these issues. And I think, and I'm hopeful, and I'm actually quite confident that today's session will be consistent with the very high level that you've managed to achieve over the past year. We're going to deal with an issue that is really in many ways pulled straight from the headlines. So many people right now focused, of course, on vaccination, on access to vaccines. We see Some countries, bursting ahead, doing very, very well. We see other countries struggling. At times it's logistics, at times it's access. And we certainly see right now some countries that are in really dire straits in a desperate situation, which I think makes things really difficult and makes these issues particularly relevant. Now, as you just heard, we've got two exceptional panelists with David Merchant and Didier Patry. And so what we'll do is we'll spend the first 20 minutes or so with a series of questions to sort of set the groundwork, set the framing for this discussion, and then shift on to your questions. And so, as been mentioned, everyone is encouraged to please pose their questions, and we'll do our best to, during this discussion, to answer as many as we can. And I know there'll be efforts to try to engage in follow-up as needed. Why don't we start with the question, with a little bit of vaccine envy, in a sense, at least from a Canadian perspective, where we've done better over the last few weeks, but it has certainly been in a bit of a struggle and a source of frustration for many at the rollout. And the country that we look to, and the country that I think people around the world have been looking to, of course, is Israel, where we have seen far higher vaccination rates really than anywhere else, far faster than anywhere else, with some pretty aggressive and innovative approaches to gaining that access. David, can you kick us off by describing some of the key ingredients that led Israel to this point?
Sure. Thanks. Thanks for inviting me. Good afternoon. So I think with Israel, what made it success, there are, I would say, three types of factors. The first one were factors that are not connected to the healthcare system at all, just connected to the country, which is its relatively young population. We only have 12% of the population that's over 65 compared to countries in Europe, Italy, France, Germany, 20 to 23% over 65. The other thing is that 80 of all of elderly people, 80% get a visitor from their family every week. Part of it's a small country. So the result was, when we rolled this out, we weren't having a situation of how do we get to these elderly. The family members took them, so there wasn't an issue. And then for bad reasons, we're used to dealing with national emergencies very well, that we're really good at arguing in general. But when a national emergency comes around, we actually somehow figure it out and come together. Then there's another set of factors that our healthcare system was very well set up for it. In Israel, we have 4 competing HMOs, and every single person must be a member of one of them. And the result is they have all of your contact information, all of your health history, and it's easy to get in touch with you. The other thing is, because of our socialist agricultural roots, starting in 1910, all of our healthcare was community-based. The idea being walking distance for agricultural workers. So every town of any size has a community healthcare center, so it was easy to get vaccinated. And then the last thing is the rollout itself was done really well. First of all, the people who got in front of the cameras were opinion leaders. We had the heads of the hospitals getting vaccinated, the prime minister, the heads of these 4 HMOs. The second thing is, the country has many different subgroups, and the Ministry of Health said, listen, we need to get influencers in every single one of the subgroups. So we had, for the Ethiopian community, we had advertisements in Amharic. We had specially tailored toward the Arab community, to the Bedouin community, to the Russian community. So that was really good. Another thing is how to deal with anti-vaxxers, which is the Ministry of Health said, listen, we're not gonna try to take anything down from the network or from social media, but we're gonna counter it immediately. So there were, in every language here, they had people from the Ministry of Health going on and trying to add more facts. So they weren't letting anti-vaxxers, in a sense, getting a lot of traction. And then the last thing I would say were technology innovations. One of the big issues here is we also have a lot of small communities rolling out to hostels and to nursing homes. And Pfizer came in groups of these big frozen trays of 1,000. And the question is, how do 1,000 people for each, how do we break it down? So Israel developed a technology where you could break apart the tray into groups of about 100 vaccines each. And that's something that really allowed very wide distribution. So that was something that worked well. I think the last things, I want to point out two things. One is electronic health records. It's really, really important in the rollout that the electronic health records, that every single test I do, every doctor appointment, my entire life is in this record. And we almost never change HMOs. So they have our whole family, which allows a lot of things. It allowed us basically to trade the data, aggregate data, to Pfizer and to get more vaccines early. So I think, and I can talk more about that because I think that was part of the story also.
Okay, thanks for that. That's really interesting. You know, certainly, Laurent mentioned that we've got many of our students and Professor Zarski's students participating today, and I mean, you've highlighted a whole series of issues that we've been thinking about, everything from the misinformation issues to some of the privacy issues associated with those health records. But I'm going to park those to the side for the moment, and I want to focus on the intellectual property side, because you hinted at it at the end, and it's really where I wanted to go, because for all of kind of the structural sort of foundations that you had that sort of enabled this kind of fast rollout, that only works if you actually have access to the vaccines. And in many countries where there has been a struggle to gain that access, the negotiating, particularly with pharmaceutical companies, sometimes has been a struggle. I'm curious for both of your reflections. We'll start with Didier on some of those negotiations. You know, sometimes as countries go into those negotiations with some of the large pharmaceutical companies, they have at their back the potential threat of things like compulsory licensing or some sort of mandated access that essentially says, listen, we need to strike a deal, and if we don't strike a deal, we have some legal tools to try to enable access. Didier, your thoughts to get us started a little bit on what some of those negotiations are like, and then we can go back to David, who can describe how things went specifically with Pfizer. But why don't we start more broadly with some of those questions about the interactions between governments trying to gain access and the companies themselves that are, of course, doing the supply.
Yeah, thanks, Michael, and thank you, David, for this lovely and fantastic introduction on how Israel did it. Because actually, I've got to say, here in Europe, we are very absolutely fascinated by how Israel has been able to vaccinate a large proportion of the population. It's quite amazing. You know, the point is, I think at the very beginning, what we need vaccines. We should never forget this. I mean, we need vaccines, we need strong R&D, we need folks to come up with solutions, actually. That's the primary thing. And I think one good example to watch is perhaps Oxford, is how Oxford actually was in a position to come up with a vaccine very quickly, and how they've been able to strike a deal with AstraZeneca. Just before we go to the supply chain, just before we think about how governments and countries and regions could negotiate with large pharmaceutical companies, the point is large pharmaceutical companies need the vaccine first. That's the very point. And it's quite amazing how Oxford and AstraZeneca were in a position to come up with a vaccine very soon. In fact, because they anticipated the situation. You know, their research started in 2017, actually, with the MERS, with the first virus, and then SARS-CoV-1. And then, because they were in a position to anticipate very quickly, they were in a position also to provide solutions and to offer a vaccine to the world. Now, I don't think the compulsory license was in the head of any negotiator when they did speak to big pharmaceutical companies for the supply of the vaccine in Europe in particular. That did not play a role. The point was the cost and the time of supply, and also the regulatory approval, because what we should not forget is, at least, and I think it's the same everywhere on the planet, you cannot sell a vaccine, you cannot, in fact, offer a vaccine to the public if you don't have regulatory approval. And this regulatory approval, thanks God, is very strict. I mean, it does not come up like this. You don't cook up and you don't come up with a solution, a vaccine in your own kitchen. You know, you need a specific environment. It has to be extremely clean. It has to be done under very strict supervision and, in fact, specification and processes. And that took some time. That's the very point. Today, in France, for instance, we've got 3 different vaccines on the market, right? We've got Pfizer, Moderna, AstraZeneca. Soon we're going to have a 4th one, which is Johnson & Johnson, and we've got 2 others in the pipe, CureVac and Novavax. This is what we need, actually. You know, it's people coming up with solutions, vaccines ready to be approved by the regulatory authorities. In fact, the pressure point is there. It's the regulatory authorities, and we need them to go fast to approve of those vaccines to come up on the market.
Okay, there's no doubt that the regulatory side plays a big role. But even with approval, I speak from someone sitting in a country where we have at times struggled to gain access, and we've approved the vaccines. It's gaining the access themselves. David, can you tell us a bit about how Israel managed to acquire as much Pfizer vaccine as it did?
So one thing I would say that's very public, and there's actually the agreement is published, which is Israel entered into an agreement with Pfizer, again, due to the electronic health records, of providing very significant ongoing data, including a dashboard that was updated daily, as well as weekly downloads of aggregated data of how the vaccine was doing. And in exchange for that, I mean, it doesn't say there's exchange for that, but people assume that was the reason that Pfizer gave a huge amount of vaccine to Israel, because they could really test things out. And it's turned out to be very good, I'd say both for the world and for Pfizer. And because with this data, because remember, they have our entire history of medical data of our entire lives and our entire families, they could see there've been a huge number of medical papers that have been published because of it. They say, hey, here there's a little problem. It just came out this week. For men between the age of 18 and 30, there's 1 in 100,000 issue. Here's what we suggest. So it was definitely a case of trading data. I would say using a carrot more than a stick, because Israel did, for the first time in the very beginning, in March 18th last year, so a few days after Corona started in a lot of the world, or the lockdown, the Ministry of Health, for the first time since the patent law went into effect in 1967, so the first time in 54 years, did a government use exceptions to the patents. So it was there in the background, but I just want to say, regarding AstraZeneca, I represented AstraZeneca in its negotiations with the Ministry of Health. It never came up. It never came up in a negotiation. In other words, whether we had it in the back of our head that the government might do another government use. By the way, just to explain to people, government use is different than compulsory license. It says for government use or not enough supply, the government can void or go around patent rules. And they did this with one drug called Kaletra, which is used for HIV, said we can import it for Corona. And we have to give compensation. So, but it never came up in I think there was a sense, really, both from the Ministry of Health and from AstraZeneca, we want to get this done. By the way, I guess people know AstraZeneca does it at no profit. AstraZeneca, maybe unlike the other companies, it's just at cost. And I can tell you, since I did the agreement, it's real cost. It's manufacturing, actual out-of-pocket distribution costs.
Okay, that's interesting. I mean, it's interesting to know that Israel gained this access, but did have in the background and was able to use one of these exceptions, although a government use exception. I think that actually does highlight how there are these different models. And I'll note that in Canada, we in the immediate response to the pandemic passed legislation that would have given the government the power to, in a sense, work around patent rules to obtain vaccines or therapeutics. It was certainly very much an issue. And given that at times some of our challenges, perhaps attributed to vaccine nationalism, perhaps attributed to just short supply, but there are some who have speculated that one of the reasons we struggled, at least initially, to gain the kind of access we're hoping for was that our government has been fairly aggressive on issues around pharmaceutical pricing. And so questions around whether or not the pharmaceutical companies had that in the back of their mind. And given some of those choices, we're going to reward those that had rewarded them, so to speak, in the past. But those different models, the kind of different approaches that we see play out, I think is a really interesting issue. Didier, can you tell us a bit, even within Europe, where we tend to think that the rules will be largely the same, how have there been different national models of access when it comes to this particular issue?
Well, you know, the angle that was taken by Europe was pretty much to centralize, actually, and not everybody would agree on this, but the position, the angle taken and the decision that has been made, it's been to, in fact, ask the European Union to negotiate a contract with large pharmaceutical companies to negotiate the supply, and then afterwards to organize the distribution in the different European countries. I can tell you this is a severe and serious subject of debates. And in fact, it's also part of the campaign because, as you may know it, especially in France, we're up to presidential re-elections and there will be a vote next year. And this is part of the debate. The point is, have we lost our national sovereignty by empowering the European Union to negotiate on our behalf? Or do we believe that we would have been better off by negotiating by ourselves directly with the pharmaceutical companies? The angle, the decision that has been made is no, we'll let the European Union to negotiate because we are much powerful, we are much stronger together, rather than if we were negotiating by ourselves. You know, France is in fact a small country, technically speaking, and our weight is not that big compared to the European Union, the EU, you know, as a whole. So the decision has been made to empower the EU to negotiate on behalf of the EU countries. Now, with insight, would have been whether it would have been smart to do it differently, perhaps to negotiate, to have side-by-side negotiations, I don't know. Maybe one day we'll do a business case on this. Maybe one day we looked at other models. For sure, Israel is an interesting case, and I think we've got to learn from the Israeli example. We have to learn from this example. I think Israel was very fast by anticipation to speak to pharmaceutical companies. I don't think the EU has been as fast as Israel. That's a big point, you know, and obviously once you are into the negotiation process, then you can secure very quickly a supply agreement. It's a matter of one-to-one negotiations, right? It's a matter of supply and demand. That's the big issue. That's what we have forgotten, actually. We are in a world of, you know, business freedom and supply and demand, and we had to be fast. Has Europe been fast enough? I can tell you, I cannot judge. What I do know is Israel has been very, very fast and very, very smart. Also, and as David was saying, Israel has been very much on the carrot angle, which is, guys, we'll give you incentives to work with us. We're not going to beat you up. We're not going to impose a sort of compulsory license on you. We're going to work with you. And that's the incentive. And that's the same case with Oxford and AstraZeneca. That's an incentive. Oxford put itself into a position, in fact, of negotiation with AstraZeneca and was in a position to impose a business model and a low price at cost. And I can only agree with David. What he said is absolutely right. And we can read it now. AstraZeneca is selling at cost. And that's interesting.
I do want to say some things about the negotiation that were shocking. One is that for the first time in my memory, the Ministry of Health attorneys were working on the weekends. They're WhatsApping me, they're texting me. The agreement, which was really unusual, got done very quickly. And I think there was a sense of, we want to get this done. That was one thing. The other thing was that the government agreed they really didn't know. Remember, this was back in November. People didn't know which of those vaccines would get approved and would be effective. So basically, they overbought, and they were willing to do that. For example, with AstraZeneca, they bought enough vaccines for probably 2/3 of the population just for AstraZeneca. So that's the type of thing that, and they also have agreements with Moderna and Pfizer. So, and as maybe people know, almost only Pfizer was used. So that was something. The other thing is that the government was really carrot versus stick. And I really do think it worked, which is they said, we're not going to talk about a compulsory license or government use. We're going to do the opposite. We're going to actually change the law, and they did, to give protection to the pharmaceutical companies under the vaccine law, which is that if anyone got injured, the government would compensate the individuals. And they told us during the negotiation, they said, we really appreciate the fact that the pharmaceutical industry was able to make a safe and effective vaccine, or what we think will be, in record time. And we're not going to penalize you for that. We understand it. So we're gonna, in exchange for getting the vaccines quickly, we're willing to cover your downside. And that was particularly the case, again, of AstraZeneca, since it was at cost.
Yeah, no, okay, those are some really interesting anecdotes. That issue of overbuying is a common one. Here in my own country, in Canada, we struck deals with large numbers of the vaccine makers. We were arguably a little too late or too slow, and so weren't at the front of the line for the distribution side, which is why things went a little slow at first. But there was definitely the case of overbuying. I think it provides a pretty good opportunity to segue into the issue that we see people struggling with right now. There are a lot of countries right now that are not in a position to overbuy. They can get practically nothing, or have struggled to afford vaccines, don't have the production in place. And as we see right now, certainly in India and in some other countries, the consequences are truly devastating. Now, as many will know, there are rules in place under the WTO that would open the door to creating a patent waiver that might allow for greater vaccine production in many of those countries. And there are a number of countries that have put forward calls for a patent waiver. It's in the rules. And some will say, many might say, that if you aren't going to use it now, it's hard to envision a circumstance when it might be used. But I know that you both may have different views, having been actively working on some of these issues. So I wanted to throw that open and open it to the audience, and just note that we're coming up on a time where I want to ensure that we have the opportunity to include everyone as well. So I'd encourage you to ask your questions, whether follow on from what you've heard so far or issues that haven't been addressed yet, and we'll do our best to address them. But before we get to some of the kinds of questions that are coming from our audience and attendees, Didier, why don't you start us off with a conversation about the potential role of a patent waiver when it comes to this issue of access to the countries where it wouldn't matter if they worked on weekends, they still wouldn't have access.
Yeah, I mean, Michael, I don't believe that a patent waiver in that particular case, I'm not saying I never believe in the benefits or the pros of a patent waiver, but in that particular case, in the specific situation today with COVID-19, I don't think that's the solution at all. I mean, it's not what we need. We don't need freedom. We need production capabilities and production facilities, actually. And if you look at where that type of vaccine is being produced and where the big production facilities are, it's primarily today in India. India is a big subcontractor for the world, and India is producing a lot of vaccines actually for the world. Just one institute, which is the Serum Institute of India, SII, its production capability is 1.5 billion doses per year, right? And they've said they were in a position to increase to 2.5 billion doses per year. It's absolutely massive. And those guys have the capability, the ability to, in fact, supply their own population. They made the decision not to. The decision is to supply for others, is to act as subcontractors, right, for others. The issue, in fact, that I see, the problem is with the compulsory license. At least this issue has one benefit, is that some governments have discovered what is a compulsory license, by the way. They did not know before, and it's brand new to them, and they've discovered what it's about. One issue, for instance, in France, the national system of compulsory license is limited to issued patents. Well, guess what? A lot of those patents are just applications. They've not been granted yet. They are just patent applications being prosecuted. So our current compulsory license system would not work. It would be totally ineffective regarding applications. Actually, this has initiated folks have said, we have to review this system, because for next time, then maybe we would wish to trigger it, to launch it. At the moment, it's useless. I don't believe it would work, in fact, because it does not apply to applications, only to issued patents. And also, as David said, I believe in the carrot, not the stick. I believe in incentives, and incentives to make investments, actually, for research, serious research, and attract investors. That's why I think we should look at the Oxford AstraZeneca model and the Israeli one, because I think that's the good one.
I would just like to add from I'd say a matter of fact that the lack of supply has not been an issue, at least in the West, of the reason that vaccinations haven't occurred faster. In order to do it, and we saw it here in Israel, there's a to make it happen. It's not just that the vaccines exist. You also need to bring the vaccines together with the individuals, the arms, together with the people to put the vaccines in the arms. And I think that's really important, that you need to figure an efficient way to roll those all together. And again, particularly, I would say with Pfizer and Moderna, which have a short shelf life once they've been thawed. You need to figure, and that's the issue. And also I saw recently in places I saw like Romania, Greece, they're only using 40 to 50% of the supply that's actually there. And one of the reasons there is like anti-vaxxer sentiment. So in other words, I think there are a lot of other issues that are way beyond just the physical number of vials that make it happen. And I think that's important. If I could just add one thing, just to clarify for people, and people probably know the different structures of compulsory license versus government use. It's a little bit different country to country. We have a slightly different Didier. In Israel, we have government use, and that's what the Israeli government did. And the reason that we did it is it doesn't have a lot of, I'll call it bureaucratic or paperwork. It can happen anytime. Compulsory license, like you said, in our case, it's you can only do it if 4 years have passed since an application or 3 years passed since the patent has actually been issued. And then there's also hearings. You need to prove things. So compulsory licensing is probably less useful, certainly in Israel, and I think in a lot of other places, because there are many more logistical, I'll call it bureaucratic hoops to go through, which is justifiable in a way. It should be an extreme issue. Used rarely.
Maybe, Michael, if I may add something, and on top of David's comments, which I think are fascinating and very interesting. Yes, what we've discovered, actually, we've been looking at our own compulsory license system, and then what we've realized, it's useless, as it is today, pretty much. So we've got to change it. And then we've got to put, and actually there are some folks in this country who have decided to draft a new bill and are going to put a new bill in Parliament to make sure that we improve our compulsory license system for the next time. Not this time, but for the next time. Just also one other issue, not today we're wasting doses in France. And maybe that's not acceptable. Beyond adding freedom to produce, people are requesting freedom to produce and want to lift up patents. That's not the issue. Today we've got a waste rate of 25% on AstraZeneca. We're wasting doses in this country. That is not acceptable. As David said, we need a vaccine, but we need an arm, right? We need a good logistic, and that's the logistic, in fact, that's missing. That's another issue. We should maybe look at this rather than thinking of lifting up patents.
Michael, not to say anything bad about Canada. It's a great, cold place. But I was just having a discussion earlier today with someone from Winnipeg whose mom is a retired doctor. She wanted to volunteer to give vaccinations. They wouldn't let her. So I'm just saying there's something beyond the actual vaccinations. You need to have the people to give them and the whatever.
David, no doubt there are issues around the distribution. So my wife's actually a physician who is doing some of the vaccinations in our own community in Ottawa. But just to ensure that we have some amount of balance recognizing these issues, this idea that these companies just were so innovative and have just made the big investments. There are more than $100 billion in public money that have gone to support these companies as part of this research. There was literally taxpayers around the world have provided over $100 billion to support. This was the public funding much of this. The notion that somehow the public now gets no say, and the idea that, well, it's okay. Once you have the vaccines, it's a distribution problem. There are countries around the world that have capacity to produce this vaccines and have not been able to do so. The companies have not stepped up to properly license that. And to hear this notion that somehow, well, next time we'll get to it, next time, as if we've had on the books for years compulsory license rules designed specifically to address global pandemics. Here we have one that is affecting the world with literally millions of people contracting this virus on a daily basis. But we'll wait till next time to figure out the rules more appropriately. I'd suggest the urgency there, in the same way that people are willing to work to get an agreement on the weekend, we ought to be working on the weekend to find a way to ensure that people are getting access to these vaccines, and it's not just about giving them access to the health data that they have. But in any event, there is another side here. It's over 100 countries right now have said this is something they'd like to see, and it's the West that have stepped up to create their own series of exceptions that suddenly now stand in the way of allowing exceptions there. So we heard Israel's done it, Canada's done it, but suddenly now it's not so great when other countries are looking to create some of their own exceptions as well. Just to be clear, there are these other issues, to be fair. We're starting to get some questions, and it can be certainly on these questions as well. I'd welcome them. One of the questions that we have got is what happens to the overbought vaccines. So talked about wastage. That's a problem too. David, for example, you mentioned that AstraZeneca was overbought, that Israel bought large numbers of Pfizer. What happens with those overbought vaccines?
Just to clarify, who's getting the floor?
Okay, I'm not sure if we've.
Maybe, Michael, because I see perhaps it's an issue of connection with David. David, I don't know if you can hear us. I've not heard of any issue of vaccines being overbought here in Europe. I don't think this is happening. In fact, the problem is we have not properly anticipated whether people would like to be vaccinated. Every single day on TV, we've got advertising, fantastic advertising, by the way, really well structured, emotional, very nice. But in fact, you've got people wanted to be vaccinated, but who cannot be vaccinated because they don't have the right age. For instance, my wife is waiting to be vaccinated, but in fact, she does not have the right age. So it's an administrative issue, right? In some countries, I know in the US, everybody can line up and wait to be vaccinated. Not in France. It's very structured. It's very, in quotes, organized. But it leads to some sort of disorganization. That's over-organization, if you see what I'm saying. I don't think we've got vaccines really which has been overbought. The flow is relatively working well. The problem is the organization age by age, and that is not, I don't think we're doing well on this front.
Okay, fair enough.
Yeah.
Oh, David.
Yeah, I would just want to say the situation in Israel is that, and again with AstraZeneca, which is AstraZeneca is not looking to force the government to take vaccines which it doesn't need. They're basically saying, you can use it for something else. So in other words, it wasn't a case of, wow, we have these vaccines and they're going to waste. There was an issue politically where we were sort of giving them out to other countries, and I think we decided politically it's better not to be in this situation of us redistributing the vaccines. Just let it, stay with the drug companies. Let them figure the best way to do that. We don't want to be, favoring one country over another. So that quickly got tamped down.
I'd read about that. It's interesting. I wasn't aware that that's kind of receded to the background a little bit. It's interesting. Canada also has overbought, but at this stage we're still struggling, obviously, to make sure that everyone gets at least a first dose, never mind even their second dose. Didier, you talked about some of the different approaches in Europe when it comes to compulsory licensing within Europe and their lack of effectiveness. Can you expand a little bit? We've been asked if you can expand a bit about what the EU has done and what you think the EU should be doing to try to ensure that there is greater level of harmonization on these issues.
Yeah, I think, we first of all we need to look at the different regimes of compulsory license, and indeed we need to harmonize those regimes of compulsory license, because if you don't do this, I mean, very quickly we can create a mess. We may have people, for instance, wanted to go to countries of some sort of vaccination tourism. And I don't think it would be good, because we want to avoid this, especially when we're in the middle of a lockdown. So we need to harmonize. Also, we would need perhaps a central body to decide on when to trigger the compulsory license, because we don't have any central body being able to, in fact, administrate that type of compulsory license. And in fact, we've got to realize something, that, in fact, licensing is good. Right now, at the moment, the EU is struggling on this issue. We are struggling on this issue with 5G. We're wondering, okay, is that good that we have patentees and, for instance, standard essential patent holders willing to license their patents? Yes, licensing is good. Licensing is good for the economy, and licensing should be pushed a little bit forward and presented as being good for the nation and for the people. That's what the compulsory license is telling us, right? It's good for the economy. That's maybe the big takeaway of that situation.
Right. I also think, again, carrot versus stick. So I think, for example, I know there's a lot of discussion in the Biden administration about what to do on this issue, and apparently it's quite hot, just from reading the newspaper articles. And I think in response to that, Albert Bourla, the CEO of Pfizer, says, yeah, we're going to give $70 million of vaccines for free now to India. So I think, having the pharmaceutical companies look good and getting good PR, and also with a little bit of what the threat is not a bad thing to do. Just like, by the way, in Israel, maybe I should follow up, we actually did give to the Palestinian Authority a fair bit and vaccinated Palestinian workers in Israel. Again, part of it was we wanted to look good. So, I mean, that's okay. Why not play to people's better natures as well as the stick?
Yeah, maybe Michael, if I may, I think what David is saying is absolutely fundamental. We have to be generous. Somehow, in fact, we've managed to secure supply of vaccines for us. Maybe what we should have had in mind is, hey, listen, guys, we have to share. We've got to share with other countries at some point. And also look at the different price structure. The AstraZeneca vaccine in Europe, the cost is 1.78, €1.78, right? The Moderna is about 10 times more expensive. It's about $16 or $18. There's a huge price difference in here. So we've got to learn from this. Why the heck is AstraZeneca in a position to sell a vaccine at that price, right? Then, needless to say, poor countries cannot afford a vaccine at $10 or $15, right? So we have to, in fact, promote this kind of business structure and do a forensic to understand why is it that AstraZeneca and Oxford have been able to deal together, and why on earth has Oxford been in a position to impose its business model to AstraZeneca, and why is it that they've been able to push for a specific view on the price structure? And by the way, this is thanks to their patents.
Those are good points. Actually, I wanted to sort of along those lines pull together several questions that have both raised the question of whether or not donor organizations in the EU, but it could be elsewhere, should have been more aggressive about thinking about sharing and transfer. And along those lines, thinking about not just about the patent side, but the know-how, the infrastructure in many jurisdictions. If we talk about the next time, perhaps it's not just solely about the legal issues, but also about capacity building in some of these jurisdictions. Should we be thinking about these issues, and if so, how would we go about doing that for either the next time or even now, should this continue to play out in our lives for the foreseeable future?
So maybe I would just like to emphasize one thing in your question, Michael, which is that it's not just a matter of patent waiver or not enforcing patent rights, that there is a whole lot more to manufacturing this. I would say particularly with the Moderna and Pfizer, with the RNA. I was never good at science stuff, so I'm not sure if that's their technology, I think, is much more complex. I mean, Pfizer had said something like, listen, we have 250 components from 18 different countries. And, so to put together, the question is, are we going to force, it's not just patents, it's a lot of trade secret know-how, trade secret in the sense of this is what gives us extra, economic advantage. Do we really need to, disclose all of our suppliers, all of those 280? I'm not sure that's fair to companies. So I do think, though, trying to work with them and let them be good, catch them doing something good, and to try to encourage them to give more free, to do some tech transfer, to help build facilities quicker for manufacturing. I think that's the way to go. Anyway, that's just my view.
Yeah, Michael, if I may, I think what David is saying is fundamental. In fact, we should be ahead of the curve. We've not been ahead of the curve. We didn't think ahead enough, right? So we've got to be ready for the next time. I mean, scientists are saying, guys, this is not a one shot. We'll have other types of coronaviruses that will come to us because we've got such a proximity now with the world. I mean, humans are too close to animals, and there is another potential transfer of viruses from the animal world to the human world. This is going to happen again. So we've got to be ready for the next one. And yes, we have to invest in third world countries. We've got to invest production capability, in fact, to build up production capabilities. And I should say, yes, people are saying there are hundreds of millions of public money that went into investment. Thanks God. Thanks to this, we've got vaccines. Otherwise, we would not have any vaccines, right? That's pretty much good news. But yes, we've got to think ahead, and we should be ready for the next one. And we should think about building up factories, building up production capabilities, and transferring technology to those guys locally. That's big. It's a big issue.
But by the way, next time is not like the next. It's probably in a few months because for example, we have green passes in Israel. It's valid for 6 months. So in other words, chances are we're all going to need to go through this once again later this year. So this is not a one-time event. We're not talking about, the next, we're talking about COVID, in 4 to 6 months, getting the next one down, the next.
Sorry, thanks, David. Yeah, we are, and we only have a couple of minutes left. We've got a couple of really interesting questions. This might be our last one, given time. Just appreciative of the discussion we've had so far and the complexity of some of these issues, especially around some of what we're seeing now politically around some of the compulsory licensing. For example, we've got Ron Marchant that's talking about that. Much of the compulsory licensing was really envisioned largely as kind of this binary negotiation that takes place between a country and a company, and sort of as you both have highlighted, there's carrot and stick issues now. There's the incentives we can establish. There's of course also now international organizations that are also far more active. That doesn't make it quite that same one-to-one discussion. And we've got another comment that notes that in addition, of course, to the access, there is, and David, you emphasized this, once you have the vaccine, do you have the infrastructure to ensure that this gets adequately distributed? I guess I'd be curious about your comments about, what other models should we be thinking about? What tweaks to the existing models, which may not have worked as effectively as we'd like them to ensure that kind of access? What should we be thinking about? One suggestion was, should we be linking compulsory licensing to actual showing capability of doing the distribution side? It's one thing to say you need the vaccines. It's another to say that you'll be in a position to put it into people's arms. What should policymakers, companies, governments be thinking about now as we both grapple with the current situation, but also start thinking ahead? Didier, why don't you get us started?
Yeah, I mean, something we should never forget, guys. First of all, we need scientists. We need people who are able to come up with interesting formulations and solutions. That's look at the history of the RNA and how it came up. It's quite fascinating, right? You need folks. You need people who have a solid brain, solid scientists. You need investors. That's the point too. We need cash. We need money for people to take risk because it's a risk issue, right? And second, yes, we need some leverage. because the leverage is what government would need to cut a deal that makes sense with a big pharmaceutical company. Even if you don't like it, leverage is key, right? In any sort of negotiation, especially if we want to have a specific price structure. Governments, in fact, need IP. The problem is not an IP waiver. The problem is the IP that we don't have. It's patents to be able to have some leverage, to be able to push a specific business model and a specific price structure to, in fact, being in a position to supply a lot of countries at a decent price. That's what we need.
I would say both government use exceptions and compulsory licensing include a compensation component. So I'm wondering whether the government should be starting to negotiate now about what is the compensation that, let's say, that the pharmaceutical companies get, or just put it another way, how much are they paying for it? Because if it's not as if it's free versus payment, there still needs to be some compensation. So maybe the point is, let's start negotiating. I think the governments have a lot of leverage here because the pharmaceutical companies want to look good. They do not want to be seen to be taking advantage of a pandemic situation. I think that's the PR is really for the benefit of the governments in this negotiation, and they should use that as much as possible. Show pictures of people dying on one side, show pictures of people going back to life. I sent earlier, we had a partner retreat today at my law firm. Wow, this is what I see post-corona looks like. Everyone hanging out, everyone hugging, and everyone shaking hands. It's not bad.
Yeah, Michael, if I may add a few things too. I mean, in fact, what we need to do, in other words, we need to protect pharmaceutical companies. We absolutely need pharmaceutical companies. I mean, we should. I know people. There's a serious temptation to beat those guys up, right? But the point is, we need those folks because we need vaccines, and they took risk, and we need investors. Perhaps what we should keep in mind is pharmaceutical companies themselves are at risk of patents of others. And as it happens, I do know that, for instance, Moderna has received threats of being sued in the States. Maybe that's what we should have in mind. Perhaps we should create a safe environment where the state, the government has patents that may protect the pharmaceutical companies, right? To protect them from others that could sue those guys and prevent them from either producing or putting them on them, in fact, some sort of license that would be a heavy burden on their price structure.
Yeah, no, there's certainly no question that we appreciate the role of vaccines and pharmaceutical companies. I guess I would say that's perhaps why governments have given them billions and billions and billions of dollars. Not every industry gets that. This industry does, and then turns around and says, thanks for all that cash. Now we need additional protection so that we can, in some instances, although as you've pointed out, maximize our profits based in many ways built on what the public has provided. And that's the case for a lot of the research that takes place. And that's certainly the case now in COVID. So I do wonder sometimes if, if the balance if there is a risk of the balance shifting too far. I don't think it's a matter of the public saying they no longer want to support this kind of research. It's pretty clear that these are, in some instances, matters of life and death, and so that there are great public benefits. That's why we spend the money. But if I put my copyright hat on, when we try to strike a balance in copyright, it's often about trying to ensure that there is both incentives to create, but also ensuring adequate levels of access. And that comes up here. One wonders sometimes whether or not the balance may have swung. Sometimes can swing too far in the opposite direction, but obviously it's certainly an issue that's open for debate. We've got just a couple of minutes left. One of our attendees has asked about the reported EU Commission threat of suing AstraZeneca, in this case for non-compliance on the supply schedule, and particularly, I suppose, in light of the fact that they're being supplied at cost. So it's clear there are still some tensions that exist out there between governments and the companies, in some instances on a supply basis. Any thoughts on that potential litigation?
Certainly there's no incentive for AstraZeneca not to supply. I mean, they're certainly trying to. Pascal Soriot, the CEO, has gone on record. He goes, my goal is to be able to produce 3 billion doses for people. And he feels very much like this is a crusade and it's something that needs to be done. I don't think it's for lack of trying. I don't think whatever they haven't succeeded in. They produced a lot, but they haven't produced, let's say, enough. In other words, it's sort of a weird thing. It's not like we haven't supplied it because we're supplying others or we're not putting the investment. They're trying to do what they can. I don't know what to say.
Yeah, but David, I don't know that, and I want to get Didier's view too. I mean, I don't know the specifics, frankly, in the AstraZeneca case, but it is, I think, unquestionably the case that companies have had to make choices about who they supply. It isn't simply a matter of saying, we want to supply you. They do at times make choices. The issue of vaccine nationalism has been very real, with governments at times precluding or prohibiting export of the vaccines, and that's certainly a sensitive issue for us here in Canada, given our neighbor to the south. But we see it playing out in quite a number of countries. So, I would agree certainly that at times it's the companies that may be caught in the middle in those circumstances. But this notion that, well, we just want to get you the vaccines, at times that may not. That there's more to the story than just that.
Yeah, David, Michael, if I may say about the AstraZeneca and the potential AstraZeneca EU litigation. We don't know yet whether the EU is going to sue AstraZeneca or not. It's an issue of commercial law. It's an issue of breach of contract. And of course, I think what happened is, in fact, we've not been fast enough to cut a deal with AstraZeneca. That's the problem. Britain has been, in fact, faster. They've been better at cutting a deal with AstraZeneca, and we should have been a bit better on this. The point is, perhaps we have to rethink our negotiation teams. We've got to rethink how a region or a government deals with a company like AstraZeneca or any other one, right? That's perhaps the issue. Are we fast enough? Apparently not. We've got to be on our feet and be much better at negotiating and have better negotiation teams. That's the point.
No, speed was unquestionably a major issue. I don't think there's any doubt about that. And obviously, a lot of people look at Israel and sort of with admiration that it guessed right in effect with Pfizer and moved very quickly and obviously is reaping the benefits now. We do have a question about the panel's view on the UK's rollout of its vaccine program. I don't know if either you have thoughts on that. I mean, we haven't talked about them as much, but obviously they've also have numbers that far outpace certainly what we see in the rest of Europe, and they're certainly better than what we have in Canada. Any thoughts as to how they've managed to achieve what they've achieved?
Yeah, maybe if I may say a few words, Michael, on this. I think what I can see is, in fact, Britain has taken a different view. First, they've decided to vaccinate a lot of people, as quick as possible, and not waiting for the second dose. As you know it, for AstraZeneca, you must have two doses, actually. And what they've decided to do is vaccinate as many people with the first dose. France has taken a different view. We decided first to go step by step and then first vaccinate elderly people who are at risk, who are exposed. For instance, it's a different way of looking at things. Apparently, the Britain model seems to be working better. So congratulations for those guys. And also the way they've organized the vaccination has been a bit better. Because they have a culture of local dispensaries, which we don't have in France. We're not organized that way. So they're better organized, in fact, to face a pandemic of that nature.
Yeah, I would just like to say two things on the UK rollout. One is, it's sort of unfortunate in my view that probably a lot of people who were in favor of Brexit say, hey, this proves it. This was a good idea to get out of the EU, which is really an unfortunate lesson. That was one thing. And then I guess the other thing on just in general, going back to the vaccine nationalism, I guess I find it a very worrisome trend to some extent. I mean, it's understandable, but it's really worrisome, especially in a case like this where we really do need to think about internationally. How do we get this out broadly? And there's no obviously absolute ideal of what is the right distribution and the equitable distribution, but I worry about the vaccine nationalism. Does that mean we need to set up separate manufacturing in each country? I feel like that would be a really disappointing lesson if that's what came out of this.
Okay. Well, I think that, you know what, thanks for that, David. I think that actually provides a pretty good place at which to conclude a debate that I think will be ongoing for many in the weeks and months ahead. You know, there may be differences of views in terms of sort of the role that IP plays on some of these issues and how we best ensure access, but issues around vaccine nationalism represent a whole nother issue that's a challenge where, you know, my own view would be, and I think it's the view that's shared by many, is that we're in this together and we need to find a way to ensure that all have that kind of access. You know, Didier and David, these are challenging, complex issues, and we really need expertise to be able to parse through what has been taking place and some of the ongoing challenges. And you've both done a really exceptional job in bringing that to the fore. So I want to thank you both on behalf of all attendees for participating today and for what's been I think a really stimulating discussion, and hand it back to our organizers for some concluding remarks.
Thanks, Michael. Wow, it was indeed a great and live discussion, full of very valuable reflections on an issue which is actually a very, very controversial issue, but also so there to our common future. So we certainly have to review the recording to learn more, and we will do it. And we should get the questions which were not taken over on board for lack of time, and we will do it. So thanks to all those who ask questions. They will not be lost, certainly. Thanks to our speakers, David and Didier. Congratulations to Michael. You conducted magnificently this encounter. 1 hour has passed so quick, you know. Probably you didn't realize, but it was 1 hour like that, yeah. Above all, many thanks, as always, to all of you who have been connected today. You are the protagonists, the reason for this growing encounters community. I would like to highlight the presence of all our students from so many different countries. We are growing and growing. And thanks especially to the Encounter Support Team. The Encounter Support Team is a group who is very, very active. They prepare the references, they prepare the reports of the encounters. This time the report will be drafted by Magali Contardi and by Ariel Aberdeen. And we have the pleasure to welcome 6 new members of the Encounter Support Team. They are Xiao Baiyang from China, Etu Uta from Finland, Javier López Guzmán from Spain, Fabricio Modica Barreiro from Paraguay, Jorge Luis Ordelin Font from Cuba, and Dorothy Pacu from Hungary. If any of you would like to join the Encounter Support Team, please let us know, and we will enter immediately in contact with you. So, well, this has been our 12th encounter, a full year since we started in May 2020. You remember probably we started with a general overview led by Professor Jane Ginsburg, Anselm Kappenbar-Sanders, and Laurent Manderieux, which I had the pleasure to moderate. It looked so far away then. Each encounter has been a world by itself, but you know, all together, we have the feeling that all together form a splendid source of knowledge. Hundreds of interested persons follow the encounters on the spot, but many more study them later, watch the recordings of the different encounters, read the references, read the reports, read the questions and answers. So we do believe that is a very valuable legacy for the future. And this is the reason that has brought to us to prepare an annual report comprising these 12 encounters. The annual report will include the reports, the references, the main messages, all the issues and the questions raised all around this extraordinary journey of 1 year. But this is not the end. Yeah? Our 13th encounter comes very soon, 18th of June 2021. And we have a very exciting topic, intangible cultural heritage and intellectual property. Yeah. It is my pleasure then to announce that Professor Benedetta Ubertazzi, very dear Italian friend at Bicocca University of Milano, will moderate a splendid team. And the team is composed by Thomas Matila from Finland, from Helsinki University, Harry Deacon from South Africa, now working at the University of Coventry, and Alexander Parra Peña from Colombia, who is a lawyer and graduate in modern languages, with an intellectual property master also at Los Andes University. So let me close this encounter by thanking very warmly my friend Laurent Manderieux, co-director of the Global Digital Encounters, and most of all, the person who conceived the concept, who brought it into life, and who led its development. It's time to do it after 1 year working together, Laurent. So take care, please. Take care. And come in 1 month. Do count of you for our next encounter, June 18th, 2021. Bye-bye. Thank you.